Hello and welcome to the New York Immigration Coalition's Road to Recovery video series. My name is Kaya Groom and I am the Immigrant Services Support Events Associate at the New York Immigration Coalition. The NYIC has put together a series of videos to share information and resources in response to rapidly changing policies regarding economic recovery and resilience, education, health, and social services available to support immigrant New Yorkers. Today, we will be hearing from Maria Meneses with Planned Parenthood of Greater New York. We will discuss the healthcare services available to immigrant women, how to access culturally relevant services, and ways in which immigrant women can maintain their health. Please remember this is a public space. We want to make sure it is as safe as possible for everyone, so please refrain from sharing personal information. If you have a personal question, our contact information has been pinned in the comments below. We would like to thank the New York City Council and Department of Youth and Community Development for sponsoring this video. Thank you, Maria, for joining us this evening.
Thank you very much, and thank you all the people is joining us. So my name is Maria Meneses, and I am adult sexuality educator at Planned Parenthood, and also I've been part of the Promotoras de Salud team.
Great, thank you. We are so excited to have you here with us this evening. To get started, can you share some examples of culturally relevant services and what that means for communities we serve?
Oh, yes. Give me a second, please, because my computer sometimes is not running well.
Yeah, of course. Take your time. I know when we think of like culturally relevant services, we're really looking for things like language access, kind of like information around various religious practices, things like that. So that's definitely what we would like to highlight for community members.
Yes, thank you so much. So in New York City, we have hospitals, clinics, and organizations such as Planned Parenthood, where you can have access to sexual and reproductive health, no matter your immigration status, insurance, or ability to pay. In New York City, we have many programs to cover to these services, and all people have the right to quality care. So they can have to access to these services.
Yeah, that's really good to know that people can access services regardless of immigration status, insurance status, kind of based on that. Say I'm an undocumented woman living in New York City and I don't have health insurance. Are there free health services available? And if so, where can I find them?
Yes, thank you for this question. And definitely, Planned Parenthood is a great organization, and they provide services for all people, for all genders, race, no matter immigration status. And for example, the gender affirming hormone therapy for transgender people, also STIs and tests and treatment, wellness exam, birth control, include vasectomy, use inclusive language because we understand how the difference in the Planned Parenthood wants the people feel comfortable when they come to this place. So provide services in patient language of choice. In someone is living with a physical, intellectual, or developmental disability, we work with them to accommodate their needs. So please feel free when the people come to Planned Parenthood, please feel free to say, okay, I need something else or something more or something different than another patient. Please feel free to share to this.
Awesome. You guys provide everything. So I've been told that accessing health services will make me a public charge. Is that true?
Of course not. This is the question we're receiving in the community, but the services have nothing to do with public charge. Planned Parenthood doesn't not share information with any federal institution. So our patient information is completely confidential.
Great, that's so important. As you mentioned, having access to inclusive language services and services available in your native language is so important. So, how can I find service providers that speak my language, and who can I call if interpretation services are not provided to me at a health service provider's location?
This is very, very important. You know, the people knows about this one. But New York Health and Hospitals Language Access Helpline, also, for example, the Promotoras de Salud team is certificate to provide medical interpretation for all patients. And please, when you make an appointment, feel free to say which languages you prefer to speak or to read. It's important you understand everything and also to provide needs, your information for the best treatment, or maybe you need a referral or something else. Please feel free to share your best languages for you. And here is the phone number also for the Promotoras de Salud program. So we speak English and Spanish, so we can help the people to make an appointment. And I share a little bit more about this one.
Yes, you are really the expert in Promotoras de Salud. So, who are the Promotoras de Salud? What do they do? How can I find them? And who would have access to them?
Yes, so the Promotores de Salud team works with support New York City, Nassau County, the Latinx Spanish dominant communities. So in accessing sexual and reproductive health care, we do this by conducting a street outreach, for example, tabling at community events, facilitating workshops, group education session, providing interpretation and escort services. This is very important services because sometimes, you know, it's not for all people has the same experience, so we can escort our patient to our Planned Parenthood and referral to other healthcare services. So we have the virtual hours every Monday, Wednesday, and Friday, 10 to 12 and 2 to 4. And the community members can call at 212-265-6940 if you need to make an appointment or to have a conversation about sexual and reproductive health. Also, we can connect with other services such as mammograms or primary care. These two last services PPGNY don't provide, but we can connect patients with other sites. And these sites, the community members can have access for free or for low cost. So we work with this one with other partnerships and we connect with them.
That's awesome. You guys really meet people where they're at and help them get the services they need. So to get into some other specific services, how often do I need a physical exam, breast exam, pelvic exam, and pap test?
Yeah. The first thing I want to share, everybody is different. So sometimes we need, for example, the breast exam from a clinician every year starting at 25, age 25. So breast health awareness recommended for all patients, no matter gender, okay? So the pelvic exam only as indicated, like if you have symptoms like pain or itching, etc. The information about can be applied in general for cervical cancer screening by the various facility to facility based on what testing equipment is available. When you are getting a screening done at Legacy PPNYC, the intervals are 21 to 24, PAP every 3 years, and 25 to 29, PAP every 3 years. So the HPV will automatically run as needed depending on the PAP results. And 30 to 64 PAP is an HPV every 5 years. 65 years older no longer needs a PAP or HPV test depending on your history. But please, the provider can give the best advice for every person because you know we have a different bodies, we have a different experiences, we have a different life. So the provider can say when is your next examination.
Thank you. Yeah, that's really helpful information. And we do definitely want to make sure we're checking in with our doctors who are the experts in our care to follow up on when we should be getting all of those tests done. So, another service that we get questions about are testing. So, how can I protect myself against STIs and pregnancy?
Yes, so to prevent STIs, wear condoms correctly. Not only wear condoms, but we need to use correctly. And abstinence is the two options we have. And to prevent pregnancy, you can use a birth control. In USA, we have many options: contraceptive pills, IUD, implant, ring. These methods are reversible, but the patient have another option. For example, the vasectomy and tubal ligation. These methods are not reversible. So also, it is important to get tested regularly. STIs are very common, and the most common symptoms is no symptom. This is the normal common, no symptoms. So that is why it's important. If you don't feel nothing, but you need to do the STIs test. And yeah, you need, if in case the person result positive to some STI, you can receive the treatment at Planned Parenthood, right? And you need to follow the instructions for our provider.
Yeah, it's really great that you can get both testing and treatment done at Planned Parenthood. It's like a one-stop shop. So what rights do I have if I become pregnant and do not wish to continue the pregnancy?
Yes, the pregnant person who does not want to continue this pregnancy has the right to have abortion. If you have less than 12 weeks, you can have the abortion with medication. If you are more than 12 weeks, you can have a surgical abortion in the clinic. In New York City, is allowed up to 24 weeks.
Good to know that people have those various options. Another question that we get is regards to people who are underaged. So say I'm a high school student who needs women's health services. What services are available and safe for me to access as an underage and undocumented New Yorker?
Yes, thank you for this question. So the same right is for all people, no matter age, gender, race, or immigration situation. Under the New York law, minor under 18 who understand the risks and benefit of available treatments can consent to and obtain the following sexual and reproductive health care without parental involvement: family planning care, including prescription contraception and emergency contraception, abortion, prenatal care, and care during labor and delivery, testing and treatment for sexual transmitted infections, HIV tests, and sexual assault treatment, included rape crisis counseling, and forensic evidence collection, because confidentiality is vital to sexual and reproductive health care. And New York State law protects the considerability of minors regarding such care. When a minor independent consents to sexual and reproductive health care, the healthcare provider may not disclose information about into parents or any other party without the minor's permission, or unless otherwise required or permitted by law. So maybe, for example, if the minor is below to insurance of parents, also they provide another resource for this patient.
That's really helpful information. Thank you. I know it's a lot of people, confidentiality is a barrier to care. So knowing that you can both access confidential care and confidential care services, regardless of insurance, whether you're on your parent insurance or not, that you're able to access that confidential care is really important. And we hope that people do go and access the care that they need. Moving in a slightly different direction, where can I access gender affirming services, and what gender affirming services does Planned Parenthood offer, and who is eligible for those services?
Yes, so you can have access at Planned Parenthood and gender affirming hormone therapy for transgender people to help feminizing or masculinizing. So all people have access to get these services no matter what. This is the word we use, no matter what, right? You can have the access to these services, and all people have access to get And we use an informed and consent model and serve transgender people and people at various places on the spectrum of gender identity and expression. Patient may receive some hormones on site and a prescription to fill at the pharmacy. So we also provide referrals for other services. So whether you are looking for a start hormone therapy or maybe you are already seeing a medical provider for hormone therapy, you are welcome to receive this care at PPGNY because sometimes, sometimes maybe at this time you have insurance and the insurance may be covered for this one, right? Or for any other services, right? But then maybe you get different status like income, right? So you can come to Planned Parenthood, and yeah, the services sometimes is for free and sometimes is for low cost, depends on income of each person.
That's great to hear that there's a
And
slide.
I want to share something important thing. So this is currently a big demand and we have a waiting list. However, there is a task force trying to rapidly increase the number of gender affirming hormone therapy patient we can serve. So they offer hormone therapy and course regular care and transgender people. So we have a waiting list for these services, but yeah, if not, sometimes maybe they can refer to another provider.
Yeah, that's really good to know. I think it definitely doesn't hurt to reach out to Planned Parenthood. And even if you guys aren't able to see someone, you can definitely refer them out. And we really do want to emphasize that gender affirming services are health services. So if that's something that you're in need of, you should consider it a health service and advocate for yourself to have access to those health services. So thank you so much, Maria. I really want to echo that no one should be living in fear or in a dangerous situation. And to learn more about the resources and experiences or resources and services available for people who lack insurance or lack um, status in the US, they are able to access health services. Once again, as we said, regardless of insurance status, regardless of immigration status, and we never want that to be a barrier to health services, especially here in New York City. We have Planned Parenthood locations in, I believe, almost every borough. Correct, Maria? So people should really feel free to access those services.
Yes, so we have these locations, Planned Parenthood operated in New York, but we have another location around US.
Yes, they are all over. So if you do happen to be watching outside of New York City, you can definitely look up on Planned Parenthood's website to find the Planned Parenthood near you. So thank you so much, Maria. We really appreciate you answering all of our questions. We will now be taking questions from the audience. Please remember that this is a public space and we want to make sure it is as safe as possible for everyone. So please refrain from sharing personal information. If you have a personal question, our contact information has been pinned in the comment section below. And the first question that we have gotten is, does Planned Parenthood accept walk-ins or do I need to make an appointment in order to come into Planned Parenthood?
Yes, so we live in like different situation right now. So before the pandemic, PPGNY accepted walk-ins, but at this time it's better to have an appointment. Maybe some patient cancel an appointment, exists the possibility to have an spot, but it's not 100%. So it's better to have an appointment.
Okay, that's good to know. And is Planned Parenthood offering virtual services currently?
Yes, also they provide. Yeah, this pandemic brings different things, and some of these different things is very good for our community, right? Because we don't need to travel to this clinic, and maybe if the provider thinking about it, it is better to go to the clinic. They can help to make an appointment for the follow up.
That's great. Yeah, I think like virtual appointments can be a great stepping stone and first point of contact for people who are trying to get in contact with healthcare providers. Our next question is, how can I get on the wait list for Gending affirming services?
Can you repeat the question, please?
How can I get on the wait list for gender affirming services? And if you need a minute, we can answer that later as well.
Okay, thank you so much. Yeah, so the patient or the person can call to the regular number 1-800. You have the phone number, right? Can you share on
the Planned Parenthood phone number?
Yes.
Yeah, we'll make sure we put that in the comments section so people can access that.
Or you can call the Promotoras de Salud and we can make an appointment. So yeah, that is the option.
Great. Yeah, both the Planned Parenthood and Promotoras de Salud phone numbers will be in the comment section below so people can access them. Our next question is, am I still able to access abortion services in New York since the Supreme Court decision was made public?
This is a big question. And it's very important. So abortion is a deeply personal and sometimes complex decision, and no one can make that decision for someone else, right? So we can know all the circumstances behind someone's decision to continue or end a pregnancy. So the Supreme Court must protect all people's rights and freedom and ensure equal opportunities for everyone, no matter of race or ethnicity. So where we come from or how much money we have, we should all have the freedom to decide what's best for ourselves and our families. Politics have no place in decision about our bodies. Our healthcare and personal freedom are no politician.
Yes, thank you. I think that is so important and so well said. So it is really important to know that people can still access abortion services in New York City and New York State, that you have a right to those services currently. Our next question is around birth control. So can I use birth control to manage my period, treat acne, or treat other health conditions?
Of course, you can use a birth control method not only for prevent pregnancy. So that you mentioned it, yeah. Some people they use for treat acne or something. Yeah, or manage the period. So yes, definitely.
Yeah, and definitely something you should talk to your doctor about as well, and they'll recommend the best course of care for you. So our next question is, where can I go for sex education information? I know you mentioned using condoms properly, and that's a big issue. So where can somebody go to learn how to use birth control methods and other sexual education programs correctly?
Yes, thank you. So in plannedparenthood.org, they can find any information you need. Also, we have a some chat. It's like a live chat, so they can make a question about this one. We have many videos about sexual and reproductive health, but definitely in plannedparenthood.org, you can find any information you need about sexual and reproductive health.
Awesome. And yes, plannedparenthood.org will be linked in the comments as well. So people can go in and explore your website to find all of the awesome resources that you guys have on there.
And sorry, but and also if you have a group of friends and you need something else, yeah, you can call the Promotoras de Salud and we can make a group education for 4 people, 3 people, 5 people. So we can do that because our workshops and education is for free. So yeah.
Amazing. And you just started to answer the next question that we got. So our next question is, what can a promotora help me do exactly?
Yeah. So first thing is like the education, and you can call us and maybe we can have a meeting by Zoom, for example, right? And we can talk more about any situation or any question you have. Sometimes the people call us and make question about maybe some birth control, like IUD. How works IUD? For how long can I have this birth control? So we can talk about this one, and also if the audience know about some tabling event, everything, so we can definitely we can go. We provide this education by virtual, but also in person. We start working in person.
Awesome. Yeah, I think the combination of virtual and in-person work is really, really special right now. So we can meet people on various platforms. So that's really helpful to know. Another question we have is, what do these workshops provided by both Planned Parenthood and Promotoras de Salud entail, and how can an organization or a school request a workshop?
Yes, thank you for this question. This is very important. So I think, can you share the email? But my director is Chanel Halliburton, and
Yes,
yeah, they can connect with our director.
great.
And yeah, eh, we work with adults, but we have different programs for different age, for different situations.
Mhm.
But Chanel can connect with all other teams.
Awesome. Yeah, here we have her email up on our last slide. So you can find her email there. You can also find it in our comments section. It looks like, apologies. It looks like those are all of the questions that we've gotten today, and that's all the time that we have for today. So thank you again, Maria, and thank you everyone for tuning in. To stay involved with the New York Immigration Coalition, follow us here on Facebook, Instagram, Twitter, and YouTube. You can also follow Planned Parenthood of Greater New York on Facebook and Instagram, and their website, phone number, and email are all up on the screen, as well as our email, events@nyic.org. Maria, we really appreciate having you on today and your expertise in the field. You were able to answer so many of our questions. So that is all for us tonight. Stay safe, take care, and enjoy your evening, everyone. Thank you, Maria.
Thank you so much for the invitation, and thank you for the participants.
Yes, thank you, everyone.